So let's talk diabetes.
Diabetes.
Okay, so diabetes occurs when the body is unable to process the glucose that it intakes properly. Okay? The body needs to process glucose into its cells to actually have it and absorb energy. 3 components that you need to make energy are oxygen, H2O, so water, and glucose. Your body cannot just absorb the glucose naturally. It needs a hormone called insulin. Insulin is secreted by the pancreas whenever the bloodstream passes through the pancreas, and it senses that its blood sugar is above 100. I can't remember the measurement right now, but 100. Then it secretes insulin, and insulin, what it does is it acts as a gatekeeper. Okay? It pretty much goes into the cell receptor and lets the glucose pass through the cell wall, okay, or the cell membrane, whatever you want to call it. Without the insulin, the glucose is hitting like a hard wall. It can't go through. Think of insulin like a bouncer at a club, if that's how you want to think about it. You can't just walk in the club without going to the bouncer first. The bouncer, you got to check to make sure you're good to go. Insulin opens the door for the glucose to pass through the cell. Okay, so now there's 2 types of diabetes, type 1 and type 2. Okay, type 1 is when your pancreas does not secrete any insulin. Type 1, you have none. None. Type 1, you have none. Type 1 diabetics inject themselves with insulin or have a pump that releases insulin so the body can actually absorb the blood sugar and go into the cells, preventing hyperglycemia. Okay? Insulin is secreted by the pancreas, and when the body cannot produce insulin or produce enough, so type 1, that's called type 1 diabetes. They take insulin to be able to absorb the glucose. Now type 2. Type 2 is usually referred to as insulin-resistant diabetes. Insulin-resistant diabetes. Insulin-resistant diabetes causes it, so you know how I was talking about the insulin binding to the cell to make it permeable so the glucose can pass through? The receptors on the cell are not accepting the insulin. It's like a faulty switch. It's not working all the time. So these diabetics that are type 2, sometimes they just need more insulin to kind of overstimulate the cell receptor, and sometimes they need different medications to kind of help resensitize the cell to insulin so it can actually absorb the glucose by binding with the insulin. So type 1, you have none or some. Okay, very little insulin to no insulin is produced. Type 2, you have issues at actually utilizing the insulin that your body is producing. Okay, that's the difference between type 1 and type 2. Now let's talk about hyper versus hypoglycemia. So what is glycemia? Blood sugar. Okay, your blood sugar, not your cell sugar, your blood sugar. So your bloodstream. All the cells in your body need insulin to actually uptake the glucose, except for your brain. Okay, so that's why when you have no insulin in your body, you get hyperglycemia. Your body is not able to utilize the glucose. You're not able to uptake it, so it's all building up in the bloodstream and going to the brain. So hyperglycemia, you're gonna have slow onset for hyperglycemia. The patient's condition is gonna be warm and dry typically. Sometimes they get angry, sometimes they're not fully there, a lot of altered mental status, but we have a saying, warm and dry, sugar high. Okay, hyperglycemia, warm and dry, sugar high. Okay. Now with hypoglycemia, the sugar is low because the body is taking up all the sugar. It's not getting to the brain. Okay, so the content of blood or the sugar in the blood is super low. It's all the cells are taking it for themselves and letting none get to the brain. Okay, or very little. So it's hypoglycemia. Okay, this is a rapid onset. Hypoglycemia comes on suddenly. Okay, and these patients will present like cool and clammy. They're just saying for this one again, cool and clammy. Give them candy because their blood sugar is low. All that the sugar is not making to the brain. Their brain is going without the glucose, without the energy. Okay, Cool and clammy, give them candy. Warm and dry, sugar high. Okay, hyperglycemia. I talked about that already. Okay, warm and dry, sugar high. Cool and clammy, give them candy. Let's talk about some of the reasons why patients have these conditions, hypo versus hypoglycemia. Okay, some of the reasons patients may have hypoglycemia, which is low blood sugar, cool and clammy, give them candy, is sometimes they don't eat. So they already have low sugar or glucose in their bloodstream. Their body doesn't have any fuel to actually function. And then sometimes in addition to that, they take their insulin and forget to eat. Or they don't eat enough and they take their insulin. Or they take the insulin and they forget to eat again. Okay, which is gonna, whatever sugar they had left in the blood is gonna be taken up by the cells. There's gonna be none of it going to the brain, or very little. They're gonna have hypoglycemia. That's why it's so rapid. That's why the onset happens like that. They can be fine and dandy one day, or 1 second, and all of a sudden they're outraging on you. It's crazy. Now with hyperglycemia, this is someone who probably didn't take their insulin if they need it, or forgot to take their medicine. So their cells of the body are starving. Okay, they're starving. They're not getting the sugar. All the sugar is staying in the bloodstream and going to the brain. It's going to the brain, which is going to cause issues down the line. If you have a high sugar content in your bloodstream, it's going to cause hyperglycemia. Where else does your bloodstream pass through? That's right, your kidneys. Okay, people that are diabetic have to be very careful with their kidneys, because think of your kidneys like a little strainer. Okay, your kidneys strain your blood and filter out all the gunk in there, and then you piss it out. So if you have a lot of sugar going through your kidneys, you're gonna be wearing down your kidneys. You're wearing down the filter too fast. Okay, something that goes along with hyperglycemia, high blood sugar, is DKA, diabetic ketoacidosis. This usually goes along with type 1 diabetes, but diabetic ketoacidosis, DKA, typically going to have like a fruity breath or acetone breath. Okay, the word keto is in there. What does the keto mean? Fat. Your body is diabetic, so there's a diabetic ketoacidosis. It is breaking down the fat to make fuel for itself. Normally your body uses sugar or glucose to make fuel for itself, but in this sense it's using ketones or fat. This is what happens when people go on a keto diet and they don't do it properly. They're doing the dirty keto, and they start burning fat, and that's why they have the nasty breath, the keto breath, if you ever smelled that. Their body is burning fat instead of glucose, which is sometimes healthy, sometimes not. If you're not trying to do it, it's not good for your body. DKA, diabetic ketoacidosis, acetone breath, okay, warm and dry, sugar high. These are all things to keep in mind, okay? Something else to look for with hyperglycemia, high blood sugar, is the 3 P's. Polydipsia, 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 polyphagia, that's Polyphagia, and polyuria, Polyuria. Polyuria. Polydipsia is excessive thirst. They're thirsty all the time. Polyphagia is they're hungry or excessively hungry. And polyuria is they have excessive urination. Poly means a lot, typically, and uria, urine. Phagia means it's like a phagocyte. It eats other cells, and that's why you have to break it down. And dipsia, like taking a dip in the water. You're thirsty. Okay? Why are these things happening to these patients, though? Polydipsia, let's talk about that one. They're thirsty. The amount of concentration of sugar in your bloodstream is dehydrating you. Okay? When the levels get extremely high, the sugar content is overwhelming. So your body is telling itself, I'm thirsty. I'm thirsty. So it makes you drink excessively. Okay? Polyphagia. Why is polyphagia happening? Polyphagia, excessive hunger or eating. Polyphagia is happening because your cells are starved. You have high blood sugar, your cells are not getting the glucose they need, so it's like, feed me, I'm hungry. So that's what your body's doing. Your body is telling you, I'm hungry, I need sugar, or glucose, I need to eat. So you keep eating, but your body cannot uptake it. Your body's gonna keep being excessively hungry unless you can actually absorb that glucose that you need. And polyuria, excessive urination. or multiple urination, you are trying to piss out all that sugar, okay? Or you drank so much water because you're so thirsty, or excessive thirst, that now you're very hydrated, but now you have so much fluid in you, you need to go to the bathroom. So it could be either your body's trying to excrete all the glucose through your urine, or you drank so much water and fluids to try and counteract the polydipsia that you had, that your body's like, oh, I need to pee now. So the 3 P's: polydipsia, excessive thirst; polyphagia, excessive hunger; and polyuria, excessive urination. Okay, thank you.